Oh, good afternoon, everyone. Dr. Susan Brown here, Center for Better Bones and Alkaline for Life. I'm really glad you took the time to join us. This is for our occasional question and answer period. Today we are right at February 23rd. I'm in Syracuse, New York, and it is a snowy day. However, I noticed that the birds were out singing their little song of spring. So here in upstate New York, we're anticipating spring and we're anticipating the ability to get back full swing into life in the wonderful weather. This particular month is a good time to kind of calculate what we want to do as we move forward. A little bit of time of darkness so we can look within ourselves and say, what should I actually do in these wonderful months that are coming ahead? The interesting thing about February is that it is actually known as Heart Health Month. And so I wanted to talk a little bit about heart health in addition to answer your questions. And I want to talk about this link that some scientists are noting, and they've noted for many years, between a tendency to have different types of diseases together. Like, for example, we see an association. There is a slight association between people who tend to have osteoporosis. Many of these people might tend to have heart disease. Of course, half of us, or practically half, die from heart disease. So it's a very important consideration. And osteoporosis is actually becoming such a popular topic that we look at the relationship. Science is trying to figure out the relationship. The same thing with diabetes. We know that diabetes greatly increases your risk for heart disease, greatly increases your risk for osteoporosis. We know the same thing with hypertension. We know that the body is one single unit. And you remember my favorite mandala here? The whole body is interconnected. And our work with bone health always emphasizes that we want to optimize the well-being of the entire body. And certainly, we want to pay really good attention to how the heart works. And so we're going to answer some of your questions on heart health. We know that certain nutrients are super for heart health. And we know, of course, the alkaline diet is a wonderful way to stimulate the heart and to encourage heart health with all the vegetables and nuts and seeds and high quality oils and omega-3 fats. We know that vitamin K is a particularly important nutrient for heart health, particularly K2. It's been found in Japan where people who eat higher amounts of K2 in the form of fermented soy, that is MK7, they have much better heart health and much less osteoporosis. This was discovered decades ago. And now we see it through the research that certain few nutrients really protect the heart. And one of those is vitamin K. They also protect the heart and also protect the bone. So we know one is vitamin K, and even vitamin K from plant form is very helpful. You just need to take a lot of it, whereas vitamin K from MK7 is you only need a small amount, micrograms. All forms of vitamin K from plants and from fermented foods are really excellent. That is K1 from plants and K2 from the bacteria produced. They're all excellent for protecting the heart. We know that another favorite bone nutrient, which is magnesium, we feel magnesium is one of the most important nutrients and certainly more important than calcium in many ways because we get more calcium in our diet. Magnesium is very protective of the heart. And in fact, it's essential for excellent heart functioning. Those of you that have followed my Better Bones Solution course or have worked with me will know that we really prioritize magnesium. And magnesium is really key to keeping a nice, steady, stable, healthy heart. And remember, when we measure the first morning urine, when we're looking at pH, we're really getting a pretty good idea of the mineral adequacy of the body, particularly magnesium. So if we find that our first morning urine pH is below 6.5, then we say we better pay more attention to the magnesium as well as all the alkalizing compounds like in the alkalinity C and in the different forms of nutrients that we use. All of our minerals, we design them to alkalize. Magnesium is very important, vitamin K is very important. Vitamin K, too, especially in the form of MK7, is one of the few known factors that can help prevent arterial calcification. Magnesium is also helpful. Another super nutrient for the heart is the omega-3 fats. And you've probably heard my lecture with Bill Grant, the world's most written about researcher of omega-3 fats, clearly showing the benefit of omega-3 fats on heart health. And now you can even measure your omega-3 fat level. You can find out how optimum that is. That is a wonderful breakthrough. And Bill Grant, he suspects that in the future, just like we measure blood pressure, we're going to measure omega-3 fats because they're very, very important and particularly protective of the heart and help protect from arterial calcification or the developing of plaque within the arteries. So a lot of the key nutrients we use, I just was thinking vitamin C. Vitamin C is such an important antioxidant. Linus Pauling spent a lot of time looking at magnesium, but most particularly vitamin C for heart health, seeing how that's extremely important to develop healthy heart tissue. And then, of course, there's CoQ10, which has been well recognized as one of the nutrients that serves as like fuel for the heart cells. And so CoQ10 is a very important thing to take. It's absolutely essential if you happen to be taking a statin drug, because statin drugs deplete CoQ10. But the average healthy person may think, I want to have strong bones, strong heart. This CoQ10, which serves as an antioxidant and protects the heart, is very, very helpful. So we at the Center for Better Bones, everything we do for bone health is also going to be good for heart health. And that's really important. So let me look at now some of your questions, and then you can put any, if you have additional questions, we'll probably have time to do that. We have questions on all kinds of topics, so I'm just going to go through those. I'm not going to sort out which by any particular categories. This Rachel writes, can one actually stop bone deterioration without taking these nasty drugs? Thanks so much. I'm not sure I'm doing enough for my bones, and there are no docs out there who will help you do it naturally. Well, the doctors are very busy. And so, like you mentioned, Rachel, you say all they're doing is pushing drugs. Well, drugs is the approach of allopathic medicine. If you were to find a naturopath or a functional medicine doctor, they could help you in natural ways. And it's certainly our mission at the Center for Better Bones to help you in natural ways. But I will say that what we specialize in is helping people look at the big picture. And actually, it's not just a simple matter of taking this supplement or that supplement, although the supplements are important, especially given the quality of the soil, the quality of our diet, and the problems we have in our environment. But we really emphasize, and this is for you, Rachel, in particular, we first have to find out what the cause of the problem is. We've got to understand what's happening in every case. Then we move on to an alkaline diet. Then we move on to looking at the digestion and the supplements and the stress reduction and the exercise. All of these 6 steps together are really important to being able to solve your bone health problem, to build strong bones and a strong body at the same time, without having to focus immediately jumping to bone drugs. But this is work that one has to do. And it's been my life's mission to clarify step by step what you can do to improve your own health and your bone health. And we have put all that information together, one on the website, betterbones.com. We have over 1,000 articles about bone health, but also we put it together in a series of classes. And you can find information on those classes in the tribe. Well, all of you listening are probably in the tribe. And certainly the best, most comprehensive approach for you, Jessica, Rachel, and anyone who's interested in really getting serious about their bone health is to take the Better Bones Solution course or to come to an in-person retreat with us and learn every step of the program. To take the effort to see if they can build bone health and build their entire naturally. Just about the retreat, let me say that we are going to start another in-person retreat, which I'm so excited about. We're going to Kirpalo in May. That was a wonderful event. that we did in May. And I invite all of you to see if you can't possibly come to that in May. It's going to be a great event. And maybe if you haven't seen the Bone Health Boogie, these 5-minute exercise program that we videotape there, be sure to get a hold of it. You'll find it in the tribe. And that's a wonderful thing. See if you don't come to Kripalu. If you can't, at least take the course online, because the Better Bone Solution gives you, Rachel, and everyone every step of the program. But, we have to get down and do the work. So Irene Miller Lubin writes, I'm eating lots of green leafy vegetables, kale, escargot, spinach. I know that spinach, escargot, and Swiss chard and beet greens are high in oxalates. On your K1 and K2 list of best food sources, they are good. But is it different when these greens are cooked or not, or raw in a salad? Well, generally people tolerate the oxalates very well. It's sort of rare that a person can't tolerate oxalates, but it's very common that people have difficulty digesting raw vegetables. I know that's my case. I have a certain body type, and that my digestion is not totally as robust as I'd like it. So particularly in this cold weather, definitely eat hot food, cooked food, definitely favor soups, definitely steam the vegetables. So give it a try yourself. It's better to cook the vegetables in my mind, particularly if it's cold out at all. You'll notice that traditional cultures, Japan, China, India, ancient cultures do not tend to eat a lot of raw food because they have an appreciation that your digestion is like a fire. It burns up that food and it makes it useful, and you can weaken the fire of digestion if you eat a lot of raw food. So we suggest you just give it a trial. Cook the vegetables, even if lightly, saute, steam them. Drink hot water, another great way to improve your digestion. Your grandmother probably did it. It's a great idea. Drink hot water, eat hot food. Even I spend a lot of time in South America, and it would be way hot in Cali, Colombia. It'd be way hot. People be eating soup and sweating. They say it's a very good thing like that, to sweat when you're eating. And it shows that you're really warming up the body. So, yep. Yes, Irene, I would cook the vegetables. So Tony writes, is it okay to open the Better Bones Builder capsules and then add them to a smoothie? I take them individually with grass-fed yogurt. I think the cows were grass-fed, but anyway, and only 2 at a time. It's a lot for me to get down. And Tony says she's not consistent. Tony, that's a very good idea. In fact, I myself have done that at times. In fact, if I have to take anything in a capsule, like I like to take NAC and different things, I taste them. And I say, hey, if this doesn't taste bad, then I just open it up, put it right in the smoothie. You can generally always open it up. It's just a question of how it might taste. Now, the Better Bones Builder tastes fine. And so you can open it up and put it in. Or if you're using the alkalizing minerals, you can actually crush it up and put it in your smoothie. Those are all perfectly fine to do. If you say, look, my digestion isn't that strong that I can just take those 3 or 4 capsules at once. So that's perfectly fine. In fact, one of these days I'll do a little video on how I kind of brew up a lot of these things and mix them together in a drink at certain times. Donna writes, are the CTX and the P1NP bone marker blood tests recommended to see if what I'm doing to increase my bone density is working and if I'm heading in the right direction, and how often should they be done? I am not on any bone drugs, just natural supplements and resistance training. And Donna, I think that's a great idea. I've written a lot about NTX. NTX is a bone breakdown marker, just like CTX. N-tylopeptides, C-tylopeptides tell you how much bone you're breaking down. It's very important to know if you're getting into high bone breakdown. And so those tests can be real helpful. The simple thing is to either do the NTX or the CTX, and you can get a rough idea how much bone you're breaking down. And these tests were actually developed to see if the bone drugs were working. a person would come in with a high bone breakdown. They'd say, take Fosamax, and then they'd see, can Fosamax bring those numbers down by like 30%? And if so, they considered that the drug was working. We often use these markers to see what's happening, particularly if a person has high bone breakdown. If you come back and your NTX and your CTX are high, and I've written about in our osteoporosis medical workup, which you all have access to in the tribe, I've written about what levels are considered high, but you want to bring them down if they're high. Now, it's also good to look at the bone breakdown markers in relation to the bone formation markers, because you could have very high bone breakdown, but also very high formation. The bone could be really busy building itself. Like if you were doing a lot of exercise and the bone said, oh, I'm gonna break down, recycle weak old pieces, and I'm gonna build up new pieces. So they both can be high. So you want to see the ratio of the bone breakdown, that means of the NTX or the CTX, in regards to the bone formation. This is kind of sophisticated, but Donna's probably been following our work for some time. The bone formation is the P1 and P test. So yeah, a lot of times with my clients, I measure that ratio. What's happening to the NTX? What's happening to the CTX? Are they going down together? Are they going up together? What's happening? But there also is a strange caveat. For many decades, I have studied people's bone breakdown. And I'll see many people who come in, they have a NTX or a CTX that's very low, that is like someone on a bone drug, and yet they aren't on a bone drug. Their bone is just very inactive. They're not breaking down very much bone. But then I say, well, they aren't breaking down very much bone. That's strange, because they might be still losing bone density by the DEXA, by the bone density report. Then I go back and look at their bone formation, and I see that their bone formation is very low. So their bone is like asleep. It's not building up and it's not breaking down. That is a totally different problem, and you want to stimulate those bone cells to wake up. And this is where you get into the use of higher antioxidants. So the markers are important. Know that we do not want high bone breakdown unless bone formation is also high. You might get your tests. If you have questions, you come on in for an appointment, or see if you've got a naturopath or a holistic doctor who knows about that. But the markers can help you, particularly if you start with high bone breakdown, to see if you're getting more normal, if they're lowering the NTX or the CTX. And interestingly, these markers can change fairly quickly. So you ask, how often should we do it? Certainly every 4 or 5 months, you can see quite rapid change. And if you do something stronger, like a bone drug, or I've seen it with high dose vitamin C therapy, those markers can change fairly quickly in some cases. Okie dokie. So Becca writes, I found a kimchi I really like, but can only consume 1 tablespoon at a sitting due to digestion. I love it a couple times a week. So regarding other fermented foods for vitamin K2, does any fermented vegetable qualify, like fermented sliced carrots? And is 1 tablespoon enough to consume each day, or is a 1/4 cup necessary? Well, so any form of fermented food is great. You can't necessarily say it's got a lot of vitamin K2, but it has beneficial bacteria. So sauerkraut is very good, kefir, yogurt, fermented carrots if they're truly fermented, or pickles if they're true pickles. So it's hard for me to judge the amount of vitamin K. There are some tables about the MK7 content of certain foods, and you can look those up, and we've published a few of those on betterbones.com. But the important thing is, eat the fermented foods you can, and then it's probably very wise to use a vitamin K supplement with MK7. You only need small amounts of it. Even 100 micrograms is a really big help, because it's probably, like you say, you can only eat a bit of kimchi. And really, where we saw that MK7 being important was with natto, fermented soy. And people ate the equivalents of 200 or 300 micrograms of MK7 a day. And most Americans can't get used to eating natto. It's like the Limburger cheese of Japan, a very strong tasting and smelling thing. So yeah, use whatever fermented foods you can. Don't worry about the quantity, but consider one of the most important nutrients would be to just take some vitamin K2 as MK7. So Robin wants to know, do any of the nutrients suggested help lower homocysteine? If not, what would be recommended? So that she has two questions. Homocysteine is a really important thing. It's a sign of how well we're methylating, how well we're able to how we're, in a sense, how well we're able to detoxify. And if we're building up this toxin called homocysteine in the blood, which homocysteine is a risk factor for heart disease, and it is a risk factor for osteoporosis. Homocysteine, you'd like the level to be, maybe 10 or lower. But certainly the two key nutrients that can help with homocysteine right away are B12, methylated B12, and methylated folate. And so many companies have a B12 and folate formula. The one I often use is VesselGuard by Perk, but there's many companies that have that. In fact, we'll probably produce our own soon. It's a very important thing, that B12 and the folate. And then, of course, what really helps are sulfur compounds like onion, garlic, eggs, broccoli sprouts. These things will help to give you sulfur, which then is used to actually help proper methylation and help bring down homocysteine. The wonderful book on this homocysteine issue and methylation is Younger You by Kara Fitzgerald. It's a really wonderful book. And she has a very comprehensive diet with lots of methyl factors. If you're all interested in this, I'll try to one time present a little discussion of methylation and how we can enhance it. But the alkaline diet's a great start. More eggs, more broccoli, more sulfur-containing compounds, more, those onions are really good also. Now, Robin also writes, as for CoQ10, was that she apparently heard me lecture and she didn't know whether it was 2 or 3 times a day. I mean, CoQ10 is a great nutrient. When I studied with some of these researchers who brought CoQ10 from Japan a few decades ago, they were talking about very high doses of CoQ10, like several hundred milligrams a day. CoQ10 is a beautiful supplement. It's something we produce in the body, but we don't really produce enough of it for many of us for the demands of healthy heart and healthy immunity. And so, even 100 milligrams helps. 200 is better. If you have a real special health concern like congestive heart failure, it's very good to take CoQ10. You might talk with the holistic doctors about just how much. And remember, today, we live in an amazing age. When I first doing this research, when I wrote my first books, you had to go to the library and you had to look in those stacks to try to find out who had done what research of how much CoQ10 to take if you had like congestive heart failure. Now you can get on the internet, you can Google, and I suggest all of you to become your own little search person, because you can go to google.scholar or you can go to PubMed and you can get the medical database where all the researchers publish their research, and you can search CoQ10 in congestive heart failure and you can find the studies and see just how much they used. So get interested in this, because there's so much you can learn. And you can look at some of the original data, try to sort it out at 100 or 200 micrograms of CoQ10, and especially a high quality CoQ10, a very good idea. Brenda writes, I have a question. McDougall, which we all know McDougall is Dr. McDougall is one of the big plant-based people. He warns against supplements. He and other scientists have warned, in particular, that calcium citrate causes aluminum to accumulate in the brain. So, and can even add to Alzheimer's disease. Certainly, I think a plant-based diet is a really wonderful thing. But it's an interesting thing happened. I just heard a research report from the New England Journal of Medicine where they're looking at people who had just really high plant-based diets, and the fact is that they were having some untoward outcomes, partly because of all the contamination of the plants. So I would say be sure to get organic foods and certainly organic plants. And in regards to Dr. McDougall and saying you don't need supplements for bone health, all I would say is everyone is very different. If you have perfect bone health, and many people, bone is not their concern. They have very good bone health. They're very strong. They're not the kind of people that come our way, but there are many such people. Actually, my research leads me to suggest that 1/3 of the people will have a needless fracture, an osteoporotic fracture in their life. I don't believe it's half like the Osteoporosis Society says, but probably at least 1/3, a significant fracture. So, if you're fine, if your bone breakdown is great, if your bone density is nice and stable, if you're strong, you got good muscles, you got good digestion, maybe you don't worry about supplements. I represent this number of people who are working constantly to regain their health through whatever circumstance, through they were born with a particular constitutional weakness, or because they've earned it during this lifetime through worry, stress, and strain. But I'll tell you, if you're doing fine, Brenda, don't worry about supplements. But if you say, hey, I'm not doing perfect, then we got to know how to try to give our cells every single thing they need to work with. And that's what we pay attention to. I don't think that calcium citrate, I haven't seen no convincing data that it causes an accumulation of aluminum. Aluminum is an interesting problem. All the contamination of our environment is an interesting problem. One thing we know that helps to remove aluminum from the body, outside of avoiding exposure to it, is actually this orthosilicetic acid. This silicon stabilized in orthosilicetic acid. And this is what we call a collagen regenerator that helps to remove aluminum from the body. So everyone, look into your own situation, but certainly we want to limit exposure to aluminum. And I have no data on. We always want to use high quality products, and there's and avoid aluminum exposure. Lee Ann writes, I've just begun taking the Better Bone vitamins in hopes of avoiding going on reclass, but I am also taking 81 milligrams aspirin 3 times a week. I'm wondering if they interact in a bad way with the vitamin K. Now, let me just say, as you all know, I'm not a physician. I'm a nutritionist and an anthropologist, and I study and I teach what I can learn. Whenever you have a thing about interactions, particularly if you're using a drug, even a drug like aspirin, it's always very good to talk to your pharmacist and see what they have to say. I certainly don't know why you're using the aspirin or what the purpose of that is. So don't ever hesitate to ask the pharmacist, hey, have him look up in the books, and he can look up in the data and see what's going on there. I certainly have not seen that interaction, but it's always worthwhile checking with the people who know. Pharmacists know about drugs and what they interact with. The hopes of avoiding reclass. So, if your bone health situation is serious enough that the doctor says you should use reclass, then you might consider, I got to really understand what's going on here. Am I losing too much bone, more than I should at my age? Do I have real signs of bone weakness? Have I fractured? Have I found that my bones do not show signs that they can hold up to the everyday wear and tear? Then you definitely, you want to take a deeper dive. I mean, it's fine to do the supplements, but remember our chart here. There's 6 steps to the program, and the supplements are just one of them. So you really want to look at the big picture, the alkaline diet. You want to look at exercise. You want to look at stress reduction. You want to look at even emotions and mental attitude. And you certainly want to look at digestion. And you want to look for any possible hidden causes of bone weakening. Are you losing calcium in the urine? Do you have a situation with your thyroid that's not ideal? Do you have a situation with your digestion where you're not using all the nutrients? So if your doctor says, geez, you should use a bone drug, then it's time to wake up and say, okay, let me really look into this and see what's happening with my bone. Because this has been my life's work, I've developed all this material and we put it together in the Better Bones solution. So if you want your best hit at avoiding a bone drug, you really should dig down, get to work, learn every step of the program, come to one of our retreats or do our retreat online or get the course online, which is like the Better Bones solution, like 10 hours of classes. You'll have it forever. It comes with a great big book. You do the program and we're happy to help you as we go along. And good luck with that, avoiding reclass, Leanne. But more, we like to focus on good luck with building lifelong strong bones because that's what we're about. And lifelong strong bones is associated with lifelong overall vitality. Jean Hampton. I have a question for Dr. Brown Bubba. How exactly does bone health affect heart health? Does stress play a part in both? Please share your suggestions for managing stress and healthy aging. Well, Jeannie, I believe you've hit you've hit right on the mark that there are many factors that can relink all sorts of diseases one with the other. And certainly heart health and osteoporosis have to do with everything from blood sugar controlled to the production of energy to digestion to many, many different things. But scientists don't know exactly the link. What they do is they see that if you have severe osteoporosis, which means that the body is breaking down in lots of ways, you better check in to see how your heart condition is. Because if we tend to be breaking down, if our bones get in kind of a really fragile state, it's very likely that our heart also is in a fragile state. Not very likely, but there's a correlation. And the same thing, if you say, geez, I got this heart issue, then they say, take care to look at bone health and do everything to maximize bone health. They do not know why there is somewhat of an association. They say, well, maybe their vitamin D deficiency might be one, or magnesium, or this low nutrient intake we have, or certainly stress. And the research on bone health and stress is now very clear to me that long-term chronic stress, we might interpret it just as worry, but it really is the body has a sensation of danger. And that when we have a sensation of danger, the first thing we do is take a bone protein out of bone and put it in general circulation to quiet down that stress response so the body can continue in fight or flight. I'm not going to take the time to explain it now, but I explain it extensively in the Better Bone Solution course, and I've written a blog called How Bone Responds to Danger. And it's very clear to me, it's clear from what I've seen over decades working with clients that stress and worry is very important to bone health. It's very damaging to bone, and it's certainly damaging to the heart. And if you go back to the ancient sciences like Ayurveda, they will say, and even the Bible, they say a happy thought, if you get happy, every cell gets happy. But you have worrisome thoughts, your bones get worried and dried up. I've cited some of those biblical quotes for you all before. Stress is really important. And we live in a pretty complicated environment. So learning ways to deal with stress, learning breathing exercises, following our spiritual paths that help us to come to feel that the universe is a friendly place. Einstein was the one who said, everyone has to decide if the universe is a friendly place or not. And if we feel threatened all the time, or even we're just remembering for some reason, we're getting triggered into fear and into worry, we know that it's good to stop, take some deep breaths, and get some help with that, because it is very clear that worry and stress is terrifically damaging to bone. And most of it, and much of it is our little internal workings of our brain. I mean, spend more time in nature, do more breathing exercises. And it's a simple thing. We have offered for free a meditation exercise, a few minutes meditation I did called Meditations for Bone Health. This is, I know we've offered it to everybody in the tribe. And if you don't find the link, just give us a note. But do systematic breathing exercises to quiet down the breath. Even a few times a day is going to help a lot. And then look into these many modalities that we talk about in the Better Bones Solution course, modalities to nourish and quiet down the nervous system. And one big tip I would say is get out in nature as much as you can. Get out of your head and into nature. See the beauty of nature, the organization of nature, the intelligence of nature, and know that that same intelligence lies right within you. Stress can be important. When you feel good, your cells are happier. Happier cells function well. Interesting. I remember years ago, Deepak Chopra, who's one of my great teachers, said he saw a study that they looked at men who had had heart attacks. And they looked at these men and they studied them and they tried to figure out who was going to survive and who wouldn't. And in the final analysis, the most likely predictor of survival was if that man thought his wife loved him. We know that love is the emotion of the heart, and it's of the heart because it's related to the heart and it comes from the heart. So paying attention to our emotions, our more refined emotions, and dealing with the stresses and strains in a more compassionate way, a way that's kind to ourselves and kind to others, is going to benefit us all. So stress does play a big role. There are many, many approaches to stress. Some people like tapping. Some people like to deal with these, like I particularly love yoga. I love meditation. I love the teachings of Deepak Chopra and some of these ancient Vedic teachers. I'm now fascinated with Acharya Shunya, who's written a new book on Ayurveda lifestyle. But even our ancient wisdom from the Christian tradition tells us a lot about a peaceful heart. And it has to do with forgiveness and compassion. And there's so many techniques now. In fact, today you could just Google what are the best ways to reduce stress. You'll find all sorts of wonderful books. And I'm happy to list some more if you want for you later. The next question is, again, another question of stress and heart disease. And certainly, I guess a simple guideline I'd give you is when we feel contraction, like if I'm sitting here and I think, oh, what if my son gets hurt working today? Then that is a contraction of my energy. And you can almost imagine that your heart's contracting. Or if I say, I'm so angry at this person, they did this, that is a contraction. Whereas if I sit here and say, I don't know why this person did it, but I forgive them, we can feel an expansion. So maybe we're just thinking, what feelings or thought lead to an expansion, a feeling of graciousness and expansion of our energy field, as opposed to a contraction. And remember, what we put our attention on grows stronger. So move our attention to something that feels expansive and kindness, and feels like it creates an opening instead of a constriction, where our whole body, our blood circulation, everything gets tight. And isn't that indeed what happens with hypertension, one of the major causes of heart disease? So let's all take a deep breath. We're going to answer a few more questions. We remember on these breaths, we like to inhale deeply, maybe to the count of 5, and exhale even slowly, maybe to the count of 6. The deep exhalation, the deep, slow exhalation is what triggers the parasympathetic nervous system to kick in and causes a quieting down of the stress response. And that's why I suggest be sure to get our free meditation on meditations for alkalizing, because it's all about using breath to control energy in the body and to control the mind. If you quiet the breath, you will quiet the mind. When you quiet the mind, you have the ability to heal the body much better. So Lisa wants to know, I've been taking D and K daily for about about 6K a day. Now, I'm not sure what, probably that 6K you're talking about, Lisa, is the vitamin D, that you're taking 6,000 vitamin D with some vitamin K. And now my blood tests show it's very high in my blood. Can people have levels that are too high? Well, I don't know exactly what's too high. Is it your vitamin D or is it your vitamin K? Most likely it's your vitamin D, because we don't measure vitamin K in the blood very much. And in fact, vitamin K is really very safe, except if you were on this drug called Coumadin. Vitamin K is very, very safe, and you can certainly check that out with your pharmacist. But the vitamin D, you can get too high levels of vitamin D. And my work at the Center for Better Bones, I generally don't put vitamin D together with vitamin K, because everyone needs their own particular amount of vitamin D, enough to get to maybe a 40 to 60 blood level, or a 70 might be okay too. But everyone needs maybe, vitamin D can vary what you need. Some people only need 2,000 milligrams. Some people need, like me, like maybe 7,000. It really varies. But vitamin K, pretty much it's pretty similar. Like, you want to have plenty of K1 from green leafy vegetables. All you can eat, the better. And you want to have MK7. This is the K2, and probably 180, 200 micrograms is a good dose. So when you combine the K and the D together, sometimes you get too much D, but not enough K. So I don't like putting them together. Now, the reason they put them together is they both, they can work together as fat-soluble vitamins to help metabolism and actually help. If you take vitamin D, it's going to, for example, increase calcium absorption. And that's one of the things, the early days, they would say, take a lot of calcium. I knew doctors giving people 1,500 milligrams of calcium. And one of the reasons was they had so little vitamin D that they couldn't absorb the calcium. But now people have plenty of vitamin D. We don't need so much calcium. And certainly we want to take adequate vitamin D, and we want to take adequate vitamin K to protect the heart. But I'm not sure it's always best to take them together. But if you do, just watch your vitamin D level and adjust for it. The other thing that I got a couple other little questions here. But I want to tell you that, just as a little halftime break, that one of the really fun things, I have a wonderful staff here at Alkaline for Life and the Center for Better Bones who are really looking to see how can we help one another, help everyone maximize their health, but have some fun along the way. So Gina, our fitness expert and my personal consultant with clients, has organized a trip to Costa Rica. This is going to be next January 2024. It's going to be an amazing trip for a selected number of people who want to join us. We're going to be down there in the jungle. Gina's going to be teaching a lot of yoga. I'm going to be teaching some new insights about bone, and insights about how do we balance our emotional, mental state to maximize our opportunity for joy in this life. And so that's going to be in January 2024. We can only take 20 people with us. So if you say, hey, I want a fun trip, I want to go down and relax, dig deep into how I can explore the boundaries of building my own health, come join us. It'll be really a lot of fun in Costa Rica, January 2024. We have lots of information. If you're at all interested, sign up, because like I say, we can only take 20 people with us at this particular stage. Okay, so just a couple more comments here real quickly. Please comment on high blood pressure. Is 130/80 necessary for those of us active women over the age of 70? What is permissible? I value your insights and am learning much. Well, like I say, everyone's case is different, and I'm not a doctor, but we do want to try to keep blood pressure at a really good range. And this 130/80 is a range you mentioned. Some of us actually have lower blood pressure. Like, I'm the type of person, I actually have too low blood pressure, which has to do with adrenal functioning. So sometimes with the stress response, we get high blood pressure. Sometimes with the stress response, we get low blood pressure. So you want to, it's good to keep an eye on the blood pressure. And some of the tricks to blood pressure, of course, are stress reduction. These breathing exercises, meditation has been shown by Herbert Benson decades ago. He wrote a book called The Relaxation Response. It was a popularization of a TM technique, transcendental meditation, and it really helped blood pressure. So get yourself on a meditation program. Be sure to eat plenty of high potassium foods, fruits and vegetables, nuts and seeds. Be careful not to have too much sodium. And of course, be careful with all sort of synthetic processed foods. Try to eat fresh organic foods. That's for sure. And exercise, Tai Chi, yoga, Qigong, whatever, being outside as much as you can is a really good idea. I can't tell you if your blood pressure is a little higher, when it gets like 100, over 130, they might say, well, you're heading to a little bit of high blood pressure. Then you want to definitely look at some of the other natural remedies. But remember, magnesium, really key nutrient. Get your pH in line. First thing I do, first morning urine, get our little pH test kit, measure your first morning urine, make sure you get it in line, and do the meditations. And yeah, monitor your blood pressure. There's a lot can be done if you really are creeping up on blood pressure. Just diagnosed with severe osteoporosis. I'm extremely active and wonder if I can continue to ski or do river trips, backpacking, and all the activities would require an evac if I break another bone. Well, you mentioned break another bone. So then you'd say, I of course, I can't, I don't know your situation. And I certainly can't give any advice based on that. But if you have already fractured, then I would certainly pay attention not to fracture again. And so whether these activities might not be skiing, could continue to ski hard. Skiing is definitely an activity that can lead to fracture. So use your common sense about that. I don't know. When we see severe osteoporosis, to me, that means a person has, their bones have showed that they can't hold up to everyday activity. An osteoporotic fracture is considered a fracture if from standing height, I fall down and break my arm, break my wrist, whatever, that's considered an osteoporotic fracture. Now, if I get thrown across the room to a marble floor, it might be something different. So use your common sense. But here is the tip, and talk with the people who know your particular case. But the tip is that our bone strength is very related to our muscle strength. And so if you say, yeah, well, I'm not quite as sturdy on my skis as I used to be, then maybe you don't go on the big hills. Or maybe if you say, I get tired out really quickly, then we don't overstress ourselves. Certainly, there is a muscle bone link, and everything you do to build muscle is going to help to build bone. So we take that bigger approach, and certainly you can get an evaluation from a physical therapist. You can look into your balance, all the things that might be related to fracture. It's wonderful to be physically active. You should maybe just work with your local experts a little bit to see just which framework of exercise you feel most comfortable with and what your previous fracture experience was. Susan Andrus writes, I'm still trying to rule out any underlying cause of my osteoporosis. Well, congratulations, because that's what we want to know. Is there any cause that you can find? Because our program is a lot of work, so you want to make sure that there's no hidden nail in your shoe, so to speak. So then you say, my TSH is on the low side. I asked, my thyroid stimulating hormone is on the low side. That means that she might have too much thyroid medication, right? If you take too much thyroid medication, thyroid stimulating hormone, which is a hormone from the pituitary that tells the body either, oh, you need more thyroid hormone or you don't need more thyroid hormone. If the thyroid stimulating hormone is low, it's telling the body you do not need more thyroid hormone. You may have too much. I asked my endocrinologist if my hypothyroidism could contribute to osteoporosis, and if so, would it make sense to run a full thyroid panel? She said no to both. Well, I don't understand what your endocrinologist is thinking about, because you can certainly search it yourself. Thyroid can be very related to bone health problem. Overactive thyroid speeds up everything. It can speed up bone loss. Underactive thyroid, in this case, a thyroid, it's an underactive thyroid. The medicines you use for underactive thyroid could be contributing to accelerated bone loss. And so it's pretty easy. If your TSH, I mean, it's okay that it's low, but if it's out of range low, if they put a little mark, like L or out of range, and, you might, maybe your endocrinologist had studied all that, and she knows in your case, your thyroid medicine is just fine. It's not accelerating bone loss. But always try to find a doctor you can work with who helps you understand what's going on. And certainly getting the thyroid stimulating hormone to be in normal range. That's what you want. That's perfectly fine. Maybe yours in normal range and she's not worried about it. So last things, if water tests acidic, does it affect my urine pH when drinking a good amount of water? Well, basically, I don't know how acidic your water is, but we like a pure spring water, and a pure water would be like neutral, like a 7 pH. We, of course, our public water, they've had to sanitize so much because to get all the toxins out of it, that it's best to get a spring water, and it shouldn't be too acidic. I don't know why your water is acidic, but we want to drink plenty of water. We like to get a spring water that might be somewhat near neutral or slightly below 7, but I would try to get a pure source of water, and I wouldn't worry about it affecting the pH, because we take, in the Better Bones program, we take a significant amount of minerals that help to keep the body alkaline. The last thing, I filter with 0 water. Does this take too many minerals out? Is it good to replace? I've read it's good to replace with a shake of Himalayan salt. So I'm not sure what 0 water is. I don't know. Maybe perhaps it's like distilled water, or water that all the minerals are taken out of. But I use a reverse osmosis water, which is a little bit, the minerals and all the toxins are removed. So it's a good idea. Sometimes put a little Himalayan salt. It's a good idea. And I certainly always take adequate mineral supplements. And now some of the reverse osmosis machines will add a little minerals through the filtering process too. Well, it was really a pleasure to talk with all of you. I wish you all a great February and an opening to a wonderful spring. Know that everything we do for bone health is going to be good for the entire body. This month, it's Heart Health Month. So at Alkaline for Life, they're offering a discount on the CoQ10, and I think maybe a discount on the vitamin K2. So take advantage to stock up. Know that the few nutrients we talk about are really great for bone health, great for heart health, and pay attention. Set aside this myth that calcium is a solution. We do not want to take high amounts of calcium. We never recommend more than 400 or 500 milligrams in supplements in most cases. And we want a really strong diet. We want very high magnesium. We want to keep things in balance so that we can have a perfect pH, but do not expect that one nutrient. We've made a mistake thinking that calcium is that important, and certainly high dose calcium is not the way to go. Pleasure. You all have a great introduction to spring, and I'll talk to you all very soon. Think about coming to Costa Rica. Think about the Better Bones solution, because that's, each of us has the opportunity to dig in and find out what's going on with our bone health. I wish you well. Happy spring to you all.